He's there. Um, Hi, Megan. Welcome. This is a podcast for clinical efficiency edging so that people can be more effective in the healthcare industry. And we've chosen you with your background and your different expertise that you have to share your experience in growing a business because we all have those type of situations going on, and you're expanding your business in the near future. We hope to see you grow down into the Florida market to help more and more people. Grew up in northern Maryland now. Like I said when we spoke earlier, that I thought we were neighbors, but being in Northern Virginia and you're near the Pennsylvania line, it's a little different and everything. That's one thing. But I'm also in the market to help small to mid-sized businesses with their efficiency in doing business. That's part of what I do. But also in these podcasts, I help individuals share knowledge, like I have in the past with different organizations, share ideas, and that's what I really am focused on, is making sure that the mental health facilities can also help other communities be more successful in the recruiting and staffing industry specifically, but also in general, any other areas that are proficient to help people be effective in their business as well. And that's why I've kind of continued to communicate with people like yourself in the healthcare industry, as well as people that are helping people find jobs, because that is a very healthcare kind of situation. Communicating with those type of people and making sure you get learn who they are and what they do and what they want to do, as well as working with managers that are looking for specific type of individuals. And the conversation we had before, I think it was a good match for putting all this together. So tell me a little bit about your specific market. You're in the wellness area and help people maximize themselves is what I take it as. And how does that come together for you and what you do and your focus?
Sure. Well, thank you, Derek, for having me. I feel very welcomed and I'm looking forward to this conversation. That's kind of a loaded question. That's a lot to answer, but I'll just kind of start from the beginning a little bit. I've worked in the behavioral health field for over 20 years. I started working in the field specifically focusing on substance use disorder. And I literally kind of grew up in that environment, and I started from an entry level position in a large Maryland based corporation, and I worked my way up that corporate ladder. I started out as a support position, working like weekend hours, and then I moved up to a primary counselor, and then it kind of took off from there. And I spent the last several years in I guess the last decade or so in leadership and executive positions, and then there was a period of time in my life where I kind of had to transition. My kids were growing up. You know, I'm going to keep it professional, but just on the personal side, I had some things happen with my kids. For example, both of my children within about a year time span were diagnosed with type 1 diabetes. My oldest son, and then my youngest son was diagnosed with autism. And so I took a couple of years to really wrap my head around that. And while I was doing, taking care of my children and, our personal affairs and just try to figure out, what life was going to look like moving forward, I did some consulting work with some private practices in Maryland. And I intentionally worked for a variety of places that did different things because I had worked in the same with the same organization for so long. It was very weird for me to be on the other side of the table as an applicant to a position, or as the newbie in the practice. But in a very short time period, I was able to really get to know how other systems were managed, how other practices were managed. And so, for example, I worked for a practice that was, more of a niche setting where it was focused on maybe like a what would be considered as a higher level clientele base, where we're meeting with people that are executives or at a professional level. They're paying cash, private pay, all the way to my other program that I worked with was inner Baltimore City based, largely Medicaid based, working with clients that lived and worked in the inner city. So that gave me a very broad range of experience and what works with different populations. So I did that for a couple years, and to be quite frank, I really never had I didn't have like this lifelong or this long-term plan of opening up a place. It kind of happened very authentically and organically, kind of out of my own necessity and the necessity and the needs of the community. I've worked within the same community for the majority of my career, so I have that that background kind of in my back pocket that helps me know where the resources are, where the resources aren't, and what the needs are of the community. And I think, just to highlight that is key. So, to me, any business is largely about supply and demand. Yeah. If you go back to basics on supply and demand, it's, in my opinion, very similar in the behavioral health realm, meaning what are the community's current needs, what are people requesting or seeking help for, and where are they getting help from? Are there wait lists? And so I happen to know that a portion of the county that I live in was largely underserved, meaning we have parts of the county that are very saturated with services that are known as like our downtown area, I guess. And then there are more rural areas or suburban areas where, might be 30 or 40 minutes away from the same county, area where it's saturated, and it's difficult for them to get services because they don't have transportation, as an example. So fast forward, that's what I did. Was I decided that I was going to branch off on my own. I had done inpatient for a long period of time, and I decided I wanted to do something different, so I targeted outpatient. I knew that I wanted to do more than what your traditional private practice setting does, meaning, for the most part, if you're licensed and, you have a little bit of background. I'm quite frankly, that's a whole nother conversation. I'm seeing a lot of people new out of school that are still provisionally licensed, such as LG, and they're going out and opening up their own businesses. I'm sure a lot of people have their own opinions about that. I certainly have one. But I've seen it. So having said that, I guess what I could say is I took, that experience that I had as far as my knowledge of what the community needed and what the community I felt wanted, and I took a chance on an area that literally had no services. And I remember thinking to myself, either this is going to go big or I'm going to go broke, but it's going to be one of the two. People ask me what I'm most proud of to date, and we're still relatively very young company, so I know that we have a lot to learn and a lot left to grow, but I think I'm most proud of the fact that when I say I really mean the team that's, since grown out of Kindred. But I was able to make this come to fruition without the help of any financial backers or any kind of, board behind me kind of telling me what to do. So that's been really cool, is to be able to watch something come to fruition. And it happened very organically. And we're actually, I'm kind of following that trend instead of trying to make it what I thought it would be or wanted it to be. And I'll give you one quick example. I mentioned that I work in the, I come from the substance use disorder background. And of course, I have a lot of passion around that topic and around that population. And of course, I wanted to add that into our program, which is part of our program. But in the last several years, we've seen that there is a very high need for children and adolescent therapy. There's not a lot of folks out there that do that type of therapy. There's also issues with insurance-based, right? So the average family can't afford to self-pay for therapy. They could barely afford the co-pays that they have if they have commercial insurance. For some of them, they have a deductible, so they might have a $5,000 deductible that they have to pay off before their services, before their insurance kicks in. So that's where a big problem is, right? Like, so you might have an average family, and I'll mention this. One of the payers, one of our commercial payers, the largest in the county, largely covers our teachers and firefighters and police officers and other types of human services fields. And, they're counting on that insurance to support their children, but that insurance is rarely taken by private therapists within the community and beyond. So that's where we've been really successful, is that we take I always hesitate to say, oh, we take all insurance, but I say we take all of the major commercial insurance that I've heard of. And we also take, more importantly, I think most importantly, we take Medicaid and Medicare, because that is where our most vulnerable families are within the community, and that is where the need is. So the cool thing we're able to do is we're able to help people across the community, regardless of where they are financially, or whether they're working or not. So I'll just stop there in case you have any questions.
Well, again, like I gave you a lot of information, you gave it
Yeah,
right back to me as well.
yeah,
But when we spoke before, I was very influenced by your um, like you said, you don't have any backing, you don't have anything. You just went out there, you took the bull by the horns, is what I'm going to use as a reference, and said, you know what, I'm going to make this work. And that's the exciting part for me. And tell me a little bit more about that, because you've done so much. You've worked with, organizations and everything like that. You're giving back to the community, I feel. how how do you envision that? Because you said it was just a way to just I'm doing and looking and involving myself in the community. I'm giving back, but I'm also building my business. What all did it take for someone that's learning to build their own business? How did you do it? Because you said you're not the norm, and I took that as like that's exciting. That's exciting to hear from somebody go, you know what, I'm not the norm. I'm going to go out there and do what is needed to do to make my business successful, and that's what you've done.
yeah,
Give me a little more information
yeah,
about that, because and we talked, future plans for you to grow into the Florida market and everything like that, which is much needed, for sure, being in Daytona Beach and everything like that, and substance abuse that is so rampant in this
yeah,
area and everything like that. But, on both sides of the state, it is needed dramatically. What is your thought processes? What is your focused, because you said it was just, it just harmoniously came together and you were successful.
and it's
And
not that
that
simple.
for me
Yeah,
is exciting.
yeah,
I mean, no,
yeah,
it wasn't hard work. I'm not going to say
yeah,
you had
yeah,
sleepless nights and anything like that. I'm not going to go that far either. But I
yeah,
also feel like you made it sound so inviting when you were talking to me, and wanting to share your story of, yeah, I started my own business. I didn't have a structure to go by. I didn't have backing by other people, like you said earlier. And I think that's exciting, but people need to know about those type of people
yeah.
like yourself that doesn't have a roadmap specific. You're
Right.
focused on certain tasks, like you said, Medicare, Medicaid, people that have insurance, people that don't have insurance, and really focusing on those different aspects of it. But you said, look, I'm going to do this. I'm going to be successful. I'm not going by the regular, this is the path I'm going to take. This is how it's going to get done via your words, and was exciting to me to hear someone that goes, you know what, I'm going to get this done one way or the other and be successful. And you are. No, it's not going to happen overnight. No, it's not easy. Yes, we have sleepless nights. I'm not taking that away from you and those type of things. Totally
Yeah.
understand that
Oh, yeah.
you really inspired something in me in wanting to hear more about your story in that short amount of time we spoke before.
Yeah. So, obviously for anyone that wants to get into any type of business, I think there has to be a bit of knowledge base, and passion. I'm big on, if you ever work for me, you'll hear me use a lot of the same words. I am guilty of that. So, positivity, passionate. I don't think that I could have gotten where I am without those two things, because if you don't have those two things, then you're not going to want to put the time and effort and hustle that's required to get here. Even though I still consider myself a relatively new business, I still look back to that, those earlier days where I'm still like kind of putting the pieces of the puzzle together. Not that I'm still doing that. And I honestly don't know how I did it sometimes. I'm like, how did I do that? Like, what happened? But I will say some of the best feedback I could that comes to mind is that number one, whatever you want to do, have some kind of knowledge and educate yourself on it. I'm big on, education should never end. There's something called CEUs in our realm, which stands for continuing education credits. But in our field, you don't go to school to learn how to open up a business. You don't go to school to learn how to, make it all work and make the numbers work. So, when you're doing that, I will say that I've had to pick and choose what I'm going to, I guess, research and do on my own, and what I'm going to seek consult for. Especially in the last several years, different businesses and marketing initiatives are booming as far as helping people in these private sectors, with a specific issue that they're, tackling. So as an example I could give you, I mentioned early on, I knew when I opened up a program that I knew that I wanted it to be more than just your general private practice, which is typically, unlicensed. I mean, not that you're unlicensed, but you don't really have anyone to answer to. But you also can only do certain services. So I sought out the assistance of a CARF consultant. I knew that I wanted to get accreditation, and at first I started doing it on my own. I started doing all of the research, and then I quickly realized this is bigger than one person can manage. Like, there's no way that I could do this and do it successfully on my own. So I chose to utilize a CARF consultant that was able to walk me through that first accreditation experience and help make sure that I had the requirements that I needed, and a lot of it's, documentation and different, things of that nature, so that I would succeed. So I would say that, part of my success is being able to recognize when I am capable of doing things on my own, because I think a lot of us, we're a lot more capable than we think sometimes. Like, for example, I went into this having zero experience with, first of all, I've never owned a business before. So I had, technically zero business ownership experience. And I also had very limited experience in the, in the setting that I was opening, because I spent the large portion of my time in inpatient. So I guess, a lot of it is really like doing some deep soul searching and deciding, like, what am I capable of doing? I'm going to give it my best shot. And then sometimes I would get to some brick walls and say, I really don't know what I'm doing and I'm stuck. And that's when I would have to humble myself and say, I'm going to do a little bit of research on who does know this stuff. And then I would reach out to them and I would get some consults. So, I would say to people that are thinking about opening up anything, is that it's a very big balancing act, because I'm not going to lie, if I were to have had the necessity to rely on someone for every component of my business, I can't say that I would have been very successful, because first of all, I would have run out of money before I got started, with paying all these consultants. But I also would have, I've also noticed that, when I, say I consult with someone, or say I have someone else do something for, in my absence, then I'm not learning it, right? So like, if I'm not going through that learning process alongside whoever else is doing it for me, then I'm never going to be able to help the situation. So, an example of that right now, billing is my Achilles heel. I'll always say, like, I know the basics. I know how to credential people. I certainly didn't know that coming in, but I had to basically, get some guidance and self-train out of necessity, because I couldn't afford to pay the going rate for what billers were asking to credential per clinician, per payer. So I had to figure it out. But where I'm going to is, I'm still very limited in knowledge with billing, and that's a weakness for me, right? That's a weakness for our business, because I lack the ability to pick up when something's not right within our billing right away. Like I will pick it up eventually, but I don't have that specific insight right yet. So I recognize that as a business owner that I need some further training on that. So I'm literally in the process of, carving out the time, because that's another thing, finding time in your very busy schedule to be trainable and be teachable and make that work. So, and I definitely fall short daily of that, but it's something that's on my radar. So I think, again, it's a loaded question because there's so, we could talk about all different areas, but I think as a whole, it requires someone that's going to have, that truly has the desire to go all in on something. It's not a Monday through Friday, 9 to 5 type of thing when you're owning a business. And I don't think that's necessarily a secret. I think most people know this, or realize this. But it's also something that, I think it takes, not everybody's cut out to be a supervisor or owner or anything. So I think, a lot of times up front, it takes the person to really do some soul searching and decide what they want in life and what they think their capabilities are and what they're willing to ask for help on. So if you give me like an example or like a specific thing, I could probably, well, I know I could tell you a lot about it, but I will say, going into my journey over the first year, it was a lot of, I remember saying it was a lot of hurry up and wait. And the examples I could give you is I mentioned I went through accreditation and licensing to become, we're CARF accredited, we're licensed by the state of Maryland. And it's a big hurry up and wait process, right? So like anybody could get on the computer and Google like what the requirements are to have, ABC facility, but you have to execute it, right? You have to meet all of those requirements. So I would hustle and get all of those requirements met. And as I mentioned in that example, I utilized a CARF consultant that I did pay for to help me prepare. And then when I got to that point, then I prioritized the next big goal, like the next big project that I needed. So a lot of times when I say it's a lot of hurry up and wait, I'll hurry up and do my part, and then I'm kind of waiting for whoever's reviewing, whoever's the decision maker behind whatever policy or protocol that I'm trying to add on. And then once I hear back from them, then it's go time again. So I don't know if that makes a lot of sense to you, but basically a lot of it is just kind of like following the trends, following the needs, and being prepared and willing to deal with it as it arises
No,
constantly.
and that's the whole thing. You have to deal with the government no matter what you're dealing with, no matter what business you're in, and you have to, like you said, hurry up and wait, and get those things done so that they can do their process, and then you're sitting there going, okay, okay, you're going online trying to check to see if it's processed or not processed or in process, and those type of things are happening for you. So it's very difficult sometimes to, especially in your field, be able to be patient enough getting into those type of things. And I understand that,
Yeah,
even for me, going out there and getting my licenses and everything I needed to get done, it was like, okay, you want all these different things from me. Now I'm waiting for you for the next, 5 to 6 weeks, going,
yeah,
okay,
yeah,
keep going online and doing those things. So it's very important to know that. So you're growing and you're looking at the big picture. What do you see? And we talked about this in our other conversation. What would make you be more involved in your either community or help your clients better in any type of way that you're not spending more time? If you could you can do, here's my wand, here I go. This is what I need to be able to have everything in place, be able to communicate with my clients however they need to be communicated with. I know people, and I've spoken to other clinicians and said, they have limits and they're not going to communicate with them anymore. But going into an age where we're getting more, people want more information. What would connect your clients to you better or get you more involved with them so that they feel more connected to you as a business and not specifically you as an individual, because we know we all have boundaries and those type of things. But what would you think would be helpful for you and your business to be more successful? I know we talked about, you're going to eventually go down to Florida and have someone running the business up here in Maryland and everything like that and expand. What do you think, or do you even know what it will take to do that? Or are you looking outside of your realm and going, hey, Derek, maybe we could talk about this at some point and go, okay, I need this, that, and the other, the better communication, you know, uh, and better anything that would make you enhance your business, because it just seems like the more and more people I talk to, they want more connection with their clients. They want more availability to them, but they're like, I don't have 24 hours a day, 7 days a week. I have, my hours. Like you said, you want to continue your education and learn your business better and be able to control your cost and do those type of things. So what in the big picture would take you to the next level that you feel, or have you even looked at that as a possibility?
Sure. So, several thoughts. One thing I will say, as it relates to our specific business, is I have often said our biggest problem to date has been meeting the demand. And what I mean by that is having enough providers to meet the demand of services. And I'll mention this, and I will say this is probably an unpopular opinion. I I have noticed in the last decade or so that people coming out of college or out of their educational portion of their professional career, it's really interesting to see candidates and applicants, what their expectations and priorities are coming out of the gate of education. And I'll just cut to the chase. It seems like the new, I guess not the younger generation, or the next coming up generation. Schools are very much, they're preparing them, but also there's a lot of what's the word I'm looking for? There's a lot of assumption there that people are going to get the highest paid salary and the best of this. And I guess the point I'm making is I go back to when I first applied for positions as like an entry level clinician, and it was always the concept of like, how can I sell myself, or how can I show that I'm going to be an asset to this business? There, a lot of what I'm seeing as a business owner now is I'll have candidates come in, and a lot of it's what can I do for them to help further their career, right? And
Right.
I'm all about that, but I very much think it's a partnership. So, going back to your original question, one of my biggest things that will helps us long term is for us to put a lot of thought into who we hire and how we hire. A lot of time, energy, and expenses go into hiring and onboarding folks. And, I think all business owners can agree that it's a big letdown when we invest in someone and then a month later they resign, or 3 months later they leave, or we end up having to term them because they're just not doing what we train them to do. So I will say that one thing I'm super proud of is that, I mentioned that positivity and passion. Those are two of the main ingredients that I find are required to work with Kindred. And why I say that is I want people that are going to come work for us that want to be there. I want them to want to be there. I want them to be hungry to grow. I want them to be teachable. So, when I look at my team as a whole, I have seasoned clinicians that are, have been in, that are maybe, for example, one of our clinicians, she's spent decades working in the field. She's been a program director. She's overseen staff. She's kind of reached her max with that. And now she's ready to just kind of slow down and just do some therapy, right? But she has all of this wisdom and expertise, so she can also consult with our newer clinicians that are brand new, coming out of the gates, never had any experience. So we have both. So I find that, bringing them together and having, them work with mentors and mentees. And again, I can speak very specifically into our practice, but I'm trying to keep it more, overall. So that's one thing. The second thing, which I mentioned, was following the community's need, right? Like, if I were following my need right now, I'd want to open up a bigger IOP and do this and do that. But guess what? That would be foolish of me, because that's not where the need is right now. the need is we need more therapists that see children and adolescents. We are looking into expanding in other outlets. One of the biggest ones I can mention is the diagnosis and treatment of autism and ADHD. In our particular state, the two biggest, organizations that are known to offer very specific, neuro evaluations, like biopsychosocial evaluations specific to autism and ADHD, they have a year or more wait list. That's not realistic for a family that's struggling with an 8-year-old that's refusing to go to school, and they're, wreaking havoc in the house, and they're, they don't know what to do. They need help right now, not next year. So, our medical director and I have been working on developing, some new programming as we're expanding so that we have the space and the capabilities to meet that demand. So I will say, in the next several months, our goal is to be able to advertise that we offer, specific, testing for ADHD and autism. Like, we do it now, obviously, with our regular psychiatric nurse practitioners. But as I mentioned, partnerships and getting guidance from other places, there's a lot of up and coming, newer, like software programs, for example, that make it not only easier, but more robust for us to be able to give a comprehensive diagnosis, which enables the patient to be able to get the services that they really need in school, in their work environment, etc. So, what would be helpful for my business to be more successful? Always to have a solid, passionate, and positive team. To, always make sure that we're tending to the actual needs of the community, and we're moving in that direction. And also, I think one thing that I could say specifically for our program is that regardless of how big we get, it's very important to us that for us that our clients know that we truly care about them. So, and everybody wants that, right? But we really go, I will say that, we go above and beyond to ensure that clients feel welcomed at our program. They feel safe, they feel secure. And I'll give a little example, working in behavioral health facilities, throughout my career, it's not uncommon for it to feel very institutional, like, very like, you're sitting on a metal chair. It's not very like, welcoming. So one of the things that I did early on, and I didn't have a lot of money, was, I had this office space that was just kind of, it still looked like it was in 1978 with the wood paneling and all of that good stuff. And, I did what I could do, and I brightened it up with paint, and I brought some, comfortable furniture in. I put out like a coffee and tea bar, with snacks and, mints in the office. We have, low lights, doing all of those things, like the extra things, and, offering like, drinks and snacks and all of those types of things. It makes them feel special. It makes them feel wanted there. And, and I only mention it because it's mentioned to us all the time by clients about how welcome they really do feel. And I think that's really important, because people that feel that, they keep coming back, right? So they're not going to go off looking for, to fulfill the void that they're not getting, at one, a specific program or another. So, as far as answering that question totally, it's a lot of moving parts, but I would say it's, it takes a team of people that are on the same, obviously we always want to have a diverse team, which I think is important too. But at the end of the day, we all have to have similar values and similar goals for our clients. And what I mean by that is, having those practical values of, clients come first, and, keeping the toxic drama and gossip out of the workplace. That's important.
Oh, yeah.
Yeah.
It can get very difficult, when, like you said, coming from a recruiting and staffing background, really focused on what you're saying and being able to not only talk to people about what they are looking for, what they need, and what they desire are three things that I focus on whenever looking for someone for you. Because if they're not going to mix in with you and your company, and you're wants and needs, not being able to. I mean, most people will say, yes, I'm going to make sure that I can want to develop myself and continue to grow and so forth and so on. I mean, they can all say those things, but being able to have the ability to have the questions that you're looking for specifically is something that is very important in the staffing part of your business. And that's one thing that I can bring to the table at some point. I also wrote down ADHD. I spoke to a clinician in Dallas, and that's their focus. And I would be happy to share their information with you so
That'd be
y'all
great.
can
Yeah.
communicate those type of things again. Because what I want to do is build a community that can share ideas. And she was a great conversation, and those type of things, positivity, sharing knowledge is one of those things that I think that she brought to the table as well. And like I said, I'll send her information over to you so you have that since you're going in that direction and help you in that aspect as well.
Yeah.
Um, so again, like I told you last week, um, I want to build a community of sharing and being able to different knowledge base, being able to present different ideas to people. Like I said, with the consultant helping CEOs with their business and y'all's background in psychology was very big focus because they use similar terms, and that was very focused to me as well. So
Yeah.
that's why I really thought was a very
Yeah.
positive thing, and that's why I write notes down as we're having this conversation to really share. Great, I have people I can share with you and really bring a light to your table, and maybe
Yeah.
just because it's different in Texas doesn't mean some
Yeah.
of the
Well, it made me
guidelines.
think of something else, and I sorry for interrupting you, but it made me think of
No,
something
you're
else
good.
that's like super crucial in again most businesses, regardless if it's in my particular area of expertise. Is one thing I'm learning. Well, I've been learning from the beginning. Really, is the importance of having operational systems that scale. Right. So for us, we have an electric health record, we have our billing end, we have our email communications, policies and procedures, onboarding and training. All of those things I've had to kind of revamp as we go because what worked when I had under 10 employees doesn't work when I have 30 plus employees.
Exactly.
And that's definitely a learning curve. And I definitely think that's something where I've definitely shared resources with other similar businesses, right? Business models. Because, hey, if there's a program that's similar to mine and they have an excellent electronic health record that they love, I want to know about it because that's important. That's where we spend 90% of our time, and document all our notes. So that kind of stuff, I would definitely say systems, because if you are, especially if you're in a newer business that's doing well, that's a good thing, but you also have to plan for growth because as I said, pretty much everything I first put in place I've had to revamp and upgrade, right? Like right down to your payroll system or my phone system. That's a good example. I've had to change up my phone system because what worked when we were smaller isn't going to work now that we have more than a couple of locations. So those are just the little things that you might not think about when you're first opening up a business. And I like to save money just like everyone else. And I think I didn't mention that maybe, but obviously you have to be very careful and cautious with how you're spending your money. So I think that's important also when we talk about all of the different systems. You don't always need the most expensive, but you need what is, because there's always going to be pros and cons. I doubt we'll ever find like the perfect EHR that meets all of everyone's needs. It's just not possible. But you have to kind of outweigh the pros and cons and decide what's going to work for you and what will it still work for you next year, or will it be a problem? Because if it's going to end up costing you more money next year, maybe we should do something else, as an example. So that's some things that I've definitely found myself in. I'm constantly looking at that kind of stuff on, do we still need this? Or, what if we got this program, could we let go of that program? Because all of those things add up and they're quite expensive, and pretty much all of them, every time you hire a new employee, the price goes up, so it's something that you have to really watch. And there's lots of, and that's the other thing, there's lots of options out there. So being able to have a group of individuals to bounce ideas off of or to give reviews or recommendations is invaluable. Yeah.
Well, and getting back to the basics, like you're saying, usability is very important. If you're not able to use it or it's too difficult to use, it's not going to be, you're not going to use it because you're going to spend so much time trying to figure out how these different components work. If we can scale it down, make it like you go to one spot and you have all your calls coming in, your texts going out,
Yeah.
and being
Exactly.
able to have all your CRM in place, that you are being getting everything in one place is going to be the most important thing for your business. And being able to access it from anywhere in the world, because of a business owner, that's what we do. We go online constantly and check what's going on, what's happening, what's the deal with my business, who's communicating with somebody, who's not communicating with somebody. And that's the one thing that I feel that is coming. I have a few different options if you want to talk about them that can enhance your business. And we can have that conversation after analyzing what we do, because I feel even for me, having everything in one spot that I just log in and I can
Yeah.
see who's been in there, who's communicating with who is being attended to, like you said, is very important to make your clients feel connected. It's number one crucial part of it. And being able to go, okay, they're not following up with me. I'm sending out messages to them to make sure that I'm communicating with them. So if you have something that is all inclusive, it can better your business because you can go,
Absolutely.
okay, Derek, I'm going in. I can see all of my CRM. They're connecting with these people. I'm sending out messages. Their next meeting is in 2 days. I'm going to
Yeah.
send out a message to them and so forth.
Yeah.
So there's
And that's a
different.
great example because,
Sure.
and I'll just give you an example of like where we're in now. There's a lot of, programs that are great for smaller groups of say under 20 or under. And then there's a lot of programs that are great for like more facility and hospital based programs. We find ourselves in the position of being like a mid level company where, the prices for a system that say, a large hospital uses is out of reach for us. We can't afford that. It's not realistic, but yet the program that we can afford, it's not robust enough for our needs. So that's where I'm saying like sometimes we have to get creative and think outside of the box, because even though this really pretty one with bells and whistles would be great, it's just not attainable to us. So we have to make what we have work right now.
Well,
Yeah. So
and but also that you can, with the systems that I work with, you can add in as you need more. If you want it to be,
nice. Yeah.
just this, we'll do this. If you want
Right.
to expand it and you want, like you said, the billing and you want the other aspects engraved, we'll do that at a later date. And that's the thing with and that's why I work with smaller businesses, is to show them that you don't need a robust system. Let's take a
Right.
smaller system, use what you need from it, and then as you grow and develop, like you said, when you go down to Florida and
Yeah.
or Indianapolis or wherever you want to go, like you said, you have multiple locations, you can
Yeah.
enhance that system and go, okay, I'm
Yeah.
going to add more money to it because I'm bringing more money in because I have more clients,
Right.
I have more consultants, I have more this,
Yeah.
that, and the other. And that's the one thing where you don't need a system that is huge. You need a system that works for you now and that you will eventually grow into because it
Right.
has the attachments that go into it and will make
Right.
you profitable and be able not to
Right.
spend so much time. And you don't have to have, and I'm not trying to, a lot of people, when they say eliminate positions, it's maximizing effort, is what I look at.
Absolutely. And I'll say right now, and a perfect example of that is I'm struggling with our admin team right now, and not the people themselves, but our processes and policies, right? Meaning, what, just going back to what I just said, what worked back then doesn't work now. So we need better
Exactly.
systems in place. Like the Excel spreadsheet I created when I first started isn't going to cut it anymore. So that's a great example of where, yes, like one of our immediate goals is to combine, the CRM and the EHR and all of that good stuff, so that it makes it. And again, it's not going to take our admin team away. It's just going to make them help them do a better job and help them to be better organized.
And that's the best word to use, organized, because sometimes I don't always use the best terms. It's
Yeah.
organized. They know what they're doing. You can go into the system and see that they have accomplished what they accomplished, or they've set up the processes in place. It's not it's not difficult. You don't have to be a
Right.
programmer. You don't have to be. It's a very and like I've had to do is go through and learn. How does it work? And
Right.
and that's the one thing, it's going in, logging into one place and going, this is what's going on. This is what's happening. This is communication. This is the billing. It hasn't been billed yet. Why hasn't it been billed yet? You can ask the question. You can go into and say, this person is in the hire process. Why are we sitting on our hands? To me, they look like the prime candidate that I want. Why are
Right.
we dragging her? And you can ask those questions and you can be more involved and say, you don't have to be involved in the day to day, but you can go in and go,
Mm-hmm.
oh, okay, I'm down in Florida. I'm going to look in
Right.
and go, we're hiring people. Why is that? Why has this person been sitting in queue for 3 days?
Right.
From what I
Exactly.
see on their resume and what they bring to the
Yeah.
table is somebody I want.
Right.
So,
Right.
and then you can go admin or HR or whomever, hey, what's going on? Why is this person in queue for 3 days? And why are we doing that? And that's all the
Mm-hmm.
things that you said is usability, positive and passion for you to be able to do your job. But like you said, taking time out and learning a billing system where when you can go in and look at a billing system and go, why is this hung up in queue? Instead of going in and going, I'm going to go through each line. I have to audit this. I have to go through it. I can go in and go, this is in queue for 3 days. No. What's going on?
Right.
Why are
Right.
they not responding to us? Did we not do our job? You go to admin and go, admin, why are they responding to us? It's been 3 days. And you don't have to spend, you know, a huge amount of time on this. You go in, you check, great. Everything's flowing as it should be. Everything wants to. Now, is there going to be set up? Is there going to be verbiage that you need to set up? Is there HIPAA laws that we follow? Yes, there is. There's not anything you have to worry about that aspect of it because they've already been included in the process of doing this business. And that's the
Mm-hmm.
one thing why I'm talking clinicians now is that they've set up processes that include the HIPAA response and non-response that they're supposed to do. And that's
Mm-hmm.
the one thing where, it's very inclusive in that aspect of it, of going, okay, we're following the laws, but I'm also running my back of the house. I'm also hiring new staff for my new areas that I want to expand
Mm-hmm.
on. I'm putting my SOPs together and inputting them though so that everybody has access to them. I'm communicating with my staff and my clients in a regular way to remind them, hey, you have an appointment tomorrow. Because you said you
Mm-hmm.
work with people that, aren't always on their phone. They're not always available and so you need a way to communicate with them. If it's, sending a text to them, is it, however the process of communicating with them is, it can be set up for you so it takes away from your admin time and they can be focused on looking at those processes, making sure that all those different things are going forward for you. And that's really the nice thing about working with systems that I work with is their scalability
Yeah.
and as you grow and develop and need more,
For sure.
you're adding more staff. You can add them into it. You are having the back of the house being taken care of. You're having, communication that you want to have in the
That's right.
aspect of,
Yeah.
I'm going to Florida. I have people in house that are taking care of what they need to do in Maryland. Great. Go
Right.
to it, guys.
Yeah,
But I
and
can
you're
log
you're
in.
describing exactly where we are right now, meaning we're in that growing pain stage, right?
Yeah.
We're like I mentioned, like, I want to move to Florida, my 5, 10 year plan and things like that nature, but I'm not quite there. I have a really fantastic leadership team that has been developed over the last year or so, but I'm not quite in that spot where I can, step aside. Not that I plan on stepping aside completely, but, slow down or not be present almost daily. But that goes to tell exactly what you're talking about, all these systems in place where we're in these growing pains because it's a financial pain too, right? Meaning that, we're outgrowing our space. So I'm having to, put money into renovations and expansion that we're not necessarily making right now, but I'm doing it based off of the data that shows us that we need it, and the hope and the prayer of, yeah, it's going to all work out, right? But yeah,
and
like it's definitely growing pains. Yeah.
and growth, and that's and but that's not a bad thing to have. Like, and
Right.
that's the one thing that you need to realize is that you're any business that is growing and has to put money into the business because they see
Mm-hmm.
the focus on it coming. Same
Right.
thing with your systems. We can put the systems together that are going to be scalable, and as you need more, we can attach more and more. What do you
Right.
need? What do you want? What is, do you want to focus more in the back of the house and go, I need you to, put systems in place for the back of the house. No, I want you to focus on just communicating with the clients that I have now and making sure that and show that it's usable and the communication is worth time and effort and the money that I'm putting into it
Right.
is worth it. And then we
Exactly.
can go into the different areas because you can set up multiple phone lines in these different systems that will make you, not think that you're in just Maryland. You can set it up. You have a phone
Exactly.
in Virginia. I mean, not Virginia,
Yeah.
Florida. You can put a
Yeah.
phone number that has this. You can have and so forth, so that they feel like they're communicating with you, not through an 800 number. And that was the one
Exactly.
thing with
Yeah.
me was like, I don't want someone communicating with me through an 800 number. I want them to know
Right.
where I'm at.
Right.
And that's the one thing, make them feel
Yeah.
incorporated into my business is the other thing. You can do, what is it, 301 up there, or is it for some, I don't know what y'all's number.
301 and 410. There's a few of them now. Yeah. Mm-hmm.
I know it was
Yeah.
301 many years ago, so I'm
Uh-huh.
like, yeah, I'm
Yeah.
gonna go
Yeah.
there.
Yeah. It
But
was.
then you
Yeah.
can go over to, Florida and have a number there, and it will go into the system and answer the questions for you.
Right. Yeah.
And it will, communicate back and forth with them and make you feel like, hey, I don't have to be in this 24/7. I don't have to have my um, admin people answering the phones constantly because it's going to answer it for you. It's going to answer the
Mm-hmm.
question. And if it needs to escalate, then your admin people will be, okay, let me take the call because it's important. And those
Exactly.
are the
Yeah.
different things that I feel like your business is right there at the cusp of expanding like you want, growing into a system where that you need more help, but you don't need a robust system yet. And
Right.
that's the other
Exactly.
part of it that you can incorporate these different areas. And I think that would be a good setup for you. And like I said, it has all of the security features that you would need being in this business that would make you successful
Yeah.
and grow
For
it
sure.
as you want.
Yeah.
So
Yeah. For sure. Yeah.
so
Yeah, I
that's
totally agree. And it's, it's the willingness too. It's the willingness to reinvest. Like the way I look at it is, and I probably kind of said it. I didn't say it the way I wanted it to sound like, oh, I am having to put all this money in. But it really is, it's a choice at the end of the day as a business owner. Like I'm choosing to reinvest anything extra that's coming out of the business into the business because that's where it needs to go right now. And, speaking of like people to be successful or, being successful at the small businesses, that's one of the things you really must do. Like I've seen people open businesses and kind of have that get rich quick mentality, and it doesn't get them very far. So you have to be willing to like constantly reinvest into your your baby basically. So
and that's the nice
yeah.
thing to hear again from our initial conversation that you were like, I don't have a roadmap. I'm just making it happen. I'm doing what it needs to be done. I'm doing, what I feel is necessary to grow my business. You're focusing on the areas that are very important to you and growing into areas that are continuing to develop, like in ADHD. and being a product of that individual myself, having those learning disabilities issues and sent to a special school and so forth as I was growing up. And luckily, my parents were able to do that, even though we were a military family. But, really understanding where you're coming from and helping these kids nowadays that need the assistance because they don't understand, the parents don't understand, the teachers don't understand what is
Right.
needed to help these kids be successful. And that's the
Right.
one thing that is nice to hear is you're expanding your business, you're growing your business into areas that are needed.
Yeah,
And
for
that's
sure.
gonna help a lot. It's gonna grow your business because everywhere is needed those type of assistance. And like I said, in Dallas, I've spoken to two of your colleagues that are doing focused on those areas already and will be successful. I know your time is very valuable, so we've been on here for a minute,
Yeah.
so I appreciate your time, Megan.
Well,
It's
thank
been
you.
very,
It was very enjoyable. I appreciate it too. I love talking to people, about business and it definitely gets I think this is a piece of being able to continue to be successful is being able to have the platform to talk about, what you've been doing and listen to others and get ideas. I mean, I definitely think it brings value, and I know that I always leave the conversation like inspired to, I got to get on this now. I got to do this. So, thank you for inspiring me for the day, for sure. So,
well, it goes both ways on that aspect of it too, because again, being learning disabled and everything and having you go into that direction and wanting to help, kids in the Maryland market and eventually Florida as you're going to grow your business and everything is exciting to hear that more and more people are taking this learning disability and not looking at it as something different.
right,
It's just a different way of learning that kids learn, and that's the difference. What it is, and what will it take? I mean, I'm a more visual person. Give me when I move furniture in my house, I have to actually physically move the furniture because I'm like, I don't see how it looks. I have to, do the whole process and everything. So,
right.
but
Yeah.
I want to thank you for your
Well,
time
thank you
today.
very much. I
And I'm
appreciate it.
going to send over the information from the other colleague that I had for ADHD for you.
Wonderful. I appreciate it.
And I'll definitely be in touch with you about other things that are going on to see if it would work for you, okay?
All right. Thanks, Derek. Good talking to
Thanks,
you.
Megan. Thank you.
Bye bye.